Welcome, everyone. Jon Taylor is here again today, and I have my paper and pen ready, but it's always like I'm always curious to know. I should just email you in advance and go, "What are you going to talk about this week?" But I like being surprised. So, what do you have this week?
So I want to talk about what focusing on yourself in recovery means. I'm pretty sure this is not a rant that comes from me getting older. I A few months ago, um, out of curiosity, I started following some accounts on Instagram about parental estrangement is what they're
Oh,
calling it. So issues that I think are either enmeshment or related to enmeshment are pretty in vogue right now. So I've gotten curious about what is out there. So now my algorithm is not fun anymore, which is probably good for keeping me off of the app. But I'm learning a lot. I'm getting a lot of insight. So I'm seeing accounts from the perspective of parents whose kids have cut them off and stepped back. I'm seeing accounts from the perspective of kids. I'm seeing accounts from the perspective of parents who would say they are trying to reform themselves and repair their relationship with their kids, and everything in between. And one of the things that stands out to me is the extent of what I see explained. It feels like it goes like this. Here's what's wrong with your parent or your child and why they're doing what they're doing. And here's what you should do about it. Which ultimately I think falls along two lines, which is either here's how you manage a narcissist to shut them down, or here's how you cut someone off and move along. So it's either this manage or this cut off and move along. And it has me reflecting a lot on what I think is really valuable. While the origin of these issues, the issues that are being talked about, of course, are very real and very serious. But what I find missing is narratives about what it does to a person to be part of that system or on the other end. And that's where in the work I do with Ken Adams on enmeshment, and also what I'm seeing more and more as I work with couples, that ultimately I would say is that's the pinnacle of awareness that needs to happen. What has happened to me as a result of being part of this? And I actually think from a relationship standpoint, that's important to take stock even when things are going well. What is this doing to me to be in this? Stan Tatkin will say things like, if you can't make it fantastic for both of you, what are you doing here? Which I think ought to be the sum total of most of the relationships that we're in, with the exception of maybe those necessary dependencies like a child who is still a child. That one is not necessarily about it being fantastic for you at every point of the way. But even in that, there should be some kind of contact with why am I doing this and something that matters to you, a commitment you can really give to yourself. So with that rabbit hole I've gone down, and I actually think this is my wife and I were talking about this morning on a walk. She's a couple months away from finishing a clinical degree, and then the idea is that we'll work together in a practice, which will be fun. So we talk shop when we hang out now. And I was telling her, I think this is very in vogue right now. Here's the 5 signs someone's a narcissist. Here's the 5 signs that someone is entitled. And there seems to be this really outward focus. Let's label what's going on around us and everything that's going on. And I think the bread and butter of good therapy and good change is an orientation to the outside, which we'll talk about, but really cultivating your internal presence and the internal response, attending to the wounds that are created from the world and the relationship and the circumstances we live in. So I'm going to talk broadly um, because I think there's a lot of different ways that this applies. Of course, if you have specific questions about how this works in sexual addiction, pornography addiction, infidelity, and relationships, please ask those specific questions. But right now I'm thinking about this on a broad sense, and I think it translates here too. So I want everybody to stop and think for a minute about it, about this. Where does it get you in the long run if you become an expert on another person and how their dysfunction manifests? What does that get you? You might even check in with your own recovery. Have you read more about your parents and what was wrong with them? Have you read more about your partner and what may or may not be wrong with them? Have you read more about PTSD? Have you read more about addiction than you have read and thought about yourself and what's going on inside of you? So that's the case I want to build, is why that is really, really important. Here's where I think knowing what you're up against in relation to other people is really important, especially when we're under stress. We take life episodically. It's just this week. It's just a hard time right now. How many times have you said that to yourself? I'm just struggling for now. This isn't really a problem. Or, yeah, we're in a rocky patch in our relationship. It's not going to last forever. How many times have you said that only to find yourself in a rocky patch, or you're struggling more than you're not? So when we're under stress, our mind does not think large scale. It doesn't think big timelines. We think episodically. And so we don't see patterns. Um, Unhelpful things and reactions get locked in over time. This can be as simple as, I mean, I'll just pull an example out of there: a kid's sleep schedule, a preschooler sleep schedule, which we have found we have to be vigilant about that and not fall into the, it's just a rough patch right now, because a rough couple nights can turn into a rough couple weeks. And that really messes things up. So you have to get to a point where you can start to recognize. So on the sleep schedule example, we read about child development. We kind of know the age frames and the things that can cause a sleep regression in a kid, because when you're like this in it, when it's right here in front of you, you may not know what you're seeing. So that's where it can help to look at the larger pictures, so you can start to see patterns and you can start to have a chance to intervene on non-adaptive spirals earlier. So, bad habits don't get locked in, self-defeating ways of thinking don't get locked in. Um, Sorry, my tablet wants to keep recording, transposing what I'm saying. We don't need that. um, an example of this: my oldest, when he was born, we found out when he was about 6 months old, 9 months old, we found out that he was born with a defect in his airway. He would wheeze when he breathed. And, it started with the doctor saying, sometimes that mucus gets dried out in there and they can have a bit of a wheeze. So as he got bigger, as he got older, the problems got worse. He was hospitalized twice for a common cold, intubated one time for 17 days because of a common cold, and his airway, swelled shut. Until we got proper diagnosis imaging, where the doctors could say, "Oh, here's what's going on. There's a ring of cartilage missing, so his airway is collapsing, and that spot is staying small while he gets big." Until we had a proper diagnosis, I mean, it was like trying to hold water in a bowl made out of sand. It was one crisis after another. Um, Another example of this, manifestations of neurodivergence and autism can look like normal developmental milestones or issues. So obstinacy in a kid, sensory sensitivity, things like that can look typical, and in fact, they're not. So one thing I read recently, from the position of an autistic person: you want me to behave in a society, you want me to act a certain way in a society that was not built for me and can actually be neurologically painful for me sometimes. You call it acting out, I call it trying to cope. So again, it's helpful to know what we're dealing with from the outside, so we have the right frame of reference. I have friends with a couple of sons who are on the autism spectrum. I probably talked about them here before. Their kids, running away and hiding under a table, was not looking at, oh my gosh, what a fearful kid. When the kids were doing that, they were regulating. You'd know where to look when you couldn't find them, because they were in some tight, dark space that helped to regulate their nervous system. And you have that overarching, we think there's some neurodiversity going on here. Not something to be concerned about, actually something to applaud. Good job. You knew where your limit was at. You knew what you needed to do. Way to show up for yourself. So that can help a lot to understand larger patterns and to know what interventions or what changes will actually be appropriate and will work. So for example, with this community here, how many of you have been to marriage therapy and the therapist has prescribed, well, you two need to focus on more sex and better sex? Exact wrong thing if you don't see the whole pattern. So it's helpful. It's helpful to help us predict and to kind of see what's coming next and to right size the distress we're seeing. But once you get oriented to your landscape, you have to plot your own course and you have to make decisions about yourself. It takes a lot of energy to turn a mountain into a molehill if that's how you keep focusing on, this is addiction and I must do XYZ um, to make this better. My partner's in a trauma response and I have to make sure that there is no kind of upset or distress for them, and they don't get triggered in any way. It actually, I think, takes a lot more work than being able to accept that which I cannot control, the things outside of me. This is how it is. So I have to figure out how to plot a course. So I may look for the signs and symptoms that my partner is in active relapse. I may look like for the signs and symptoms that my partner is in active trauma response. And I know what kind of self-care to front load for myself. I know what is and is not going to be available in the relationship. And I know the kinds of ways that I can support or confront or supportively confront my partner that help turn the light switch on again, that help get this person that I love back. Um, Continue to over focus on the other and their pathology is not helpful or friendly from a relationship standpoint. It often leads to a tug of war. And oftentimes, when I hear these couples have these conversations that are clearly informed, like they're clearly informed on what the issues are, I hear these conversations happen, and I often ask myself, what what is supposed to happen in response to this? Because slinging knowledge, perspective, expert stuff like that, it doesn't actually help very often to solve relationship problems. It helps to shed a light on them more clearly. And I think that's where that internal focus has to come in. Once I know the lay of the land and I know the difficulty I have with it naturally, now we can really cook with something. Now there can really be a change. So the continued overfocus isn't helpful or friendly, and it's self-harming because you are overlooking your own needs, your own problems, your own pain. Um, and you may be looking at the role, you may be overlooking the role that you could play in the alleviation of your distress. So if my path to freedom and healing is your ongoing sobriety, if my path to freedom and healing is you never getting triggered with a trauma response again, um, there is no agency in that. And that is not a relationship. That's not an adult relationship. That's more of a hostage situation, which I don't know if you've noticed. They call it Stockholm syndrome, which is where your mind is warped to identify with your captor. But generally, I think hostages and captors don't really like each other. I don't think that's a real relaxed, good times relationship. Essentially, you're taking the system down to one wheel, one leg of the stool. When we over focus on an external pathology, so in a relationship, remember it's always I'm considering me, I'm considering you, and I'm considering us all at the same time. So it's tempting and often very relieving for us when we start, hearing these experts talk and we're like, oh my gosh, my father was a narcissist. It makes so much sense. Often relieving when we get that diagnosis and we start getting the patterns. But remember, you have to do something for yourself about it. Saying, I know what this is and I can continue on my merry way, not have to change anything or reconsider anything doesn't make a lot of sense. I know what this is. I can predict this now. I kind of know what is possible and what is not. Now I have to make choices about how I'm going to live with that. So ultimately, I would say it's disempowering and non-supportive of your own development to focus on the problem only. Again, It's not that they don't matter, but what I'm advocating here is, can you look at the problem? Can you get to know that? And can you turn inward and see how it's impacting you? So great, my father was a narcissist. What does that mean for me? There's a lot written about what gets put into the nervous system of children of narcissistic parents. There's a lot that gets written about what gets put in the nervous system of kids with parents who are addicted to sex or porn, parents who are overly needy. And again, that's where the focus needs to be. I was talking to Dr. Adams about it this weekend, and we were saying, um, that's really what we try to do in these enmeshment workshops. There's very little naming. There's very little, your parent probably had this or that pathology. It's more, there was a need that you felt or an absence you felt. What did that implant in you? What do you keep chasing that you can never find? And what are you going to do about that? So some examples of this, I forget where this comes from a while ago. Maybe it was during my undergraduate education, but we were looking at patterns of poverty and illiteracy and things like that. And I think it was a documentary we watched or a news report or something like that. You would think with impoverished families, um, and it helps. It helps a lot. You focus on job skills, you focus on money management skills, you focus on access to good, healthy food, childcare, like all of those types of things. There was one program that was not discounting all of those as a problem, but they were leapfrogging, and they were saying, one thing that we see in these families that struggle generationally with poverty is there's very low literacy levels from generation to generation. And so they were saying it's not that this other stuff doesn't matter, but what we're going to focus on is getting parents to fall in love with reading to their children, learning how to read to their children in a way that's really engaging and actually develops that kid's not just literacy, but like critical thinking and imaginations. And they were interviewing some of the parents. I'll never forget this. One woman said, I wish I would have had this as a child. Um, I never will, but I'm so glad I'm learning to give this to my kid. So this example of, you can get mired in the gigantic, big, legitimate problem that's in front of you, and you can miss a way that cycles get broken. Teach these parents and kids to read together. And what they see in the data there is, as literacy rates improve in younger generations, so does socioeconomic status. So all of these other programs that we're looking at, all of these other external things, which again is useful, needed, but there's an internal transformation that happens when we disconnect from what are all the things in front of our face to what's going on inside of this kid. Um, so it it furthers narratives. It's not empowering because it furthers narratives about an external locus of control. So it really has us mired in powerlessness. This isn't the same powerlessness as surrender. Okay, I got to pull back and rethink this. This is the, I cannot do anything until you get sober. I cannot do anything until you get well. Many aspects of another pathology are ultimately outside of your control. What books do you know that support in a serious manner a continued over focus on another's pathology at the neglect of yourself? Not one. Now, there's really interesting books that will describe the pathology of another person, but none of them in a serious way will recommend that you become an expert and you heal your narcissistic father, or you become an expert in addiction or enmeshment and turn your partner's life around. My worry is that as a whole, in this field and many others, we skip over good basic self-care, which is one of the ways that we start turning back to ourselves. Just that question, what are you feeling? You may ask that to the child inside of you. What are you needing? You may say to your reflection in the mirror. What has not been at your fingertips for a long, long time that really, really needs to happen? So I always get very excited. I see this in couples that I work with. I get very excited when they both turn a corner and they say, we want to focus less on the complaints we have about each other, and we want to focus more on individually what we want to do and what we're thinking about doing. We want to coordinate that movement with each other so we're not working against each other. Or sometimes it is a one-sided. Part of me really, really just wants to keep spending these sessions taking my partner to task for their inaction on XYZ. But I'm starting to ask myself, is that relationship work? Probably not. Um, so some ways that you can turn to yourself. I mentioned good basic self-care. Google it. What are some good basic ways of caring for yourself? I recently got a little linen feelings chart that hangs from the wall in our house. It's for everybody, not just the preschoolers. It's got the faces and then the partner tapestry, makes it sound so classy, has some simple ideas for soothing yourself. In the past few nights, we've been going to that as a family and picking a couple that seem like they'd fit the bill for what we need during the day. That's actually how those skills are developed. You have to practice them. You have to overtly learn them. Many of us did not get that consciously in our heads, so it doesn't come naturally. So don't overlook the value of good basic self-care. Being aware of the real decisions that are in front of you. So when you have an entrenched pathology in one or both partners, so when you have an entrenched pathology in a relationship that does not um, play nice with things like fairness, justice, mutual protection, sharing power, there really are, I think, only two rational choices. One is that you stay fully aware and fully informed that this will not be a relationship that meets your needs or the needs of your partner for that. So it's an arrangement. We could be nice roommates at best. And maybe that really is what's best for you in your life and in your position in life. I hold no judgment or opinion on what people should choose. The other is if I've really tried everything that I can relationally, I've really done everything I can do to improve myself, and I've crossed my fingers and hoped that you would do the same. If I've really done everything, then it's time to go. That's the other track. Those are the only two rational parts. So I'm not advocating that you make those decisions. That's really overwhelming, but start to list out in like a decision tree form. I can X or I can Y. And you have to start living with the reality that ultimately, I think of the AA prayer, that which I cannot control, and courage to change the things I can. You really have to start looking at what you can do about this for you. You have to start considering, you have to start coaxing your mind to think in that way. Because it's devastating when that which you dreamed of, that which you hoped for, isn't coming to fruition and doesn't look like it will be. So you may have to take some time to consider those choices and how awful they feel and to grieve. That can be part of our own work. In fact, even with couples that I work with who make it and get very, very happy, there's this period of grief for both. When they stop doing this, what's wrong with my partner, and saying to me, are you going to fix this? And they start saying, I guess we don't have the building blocks we thought we did. At least this is the least of what they're saying. At least we don't think we have the building blocks we thought we did. We're going to have to figure out what else we can do to get what we want. That's a big moment of transformation. There's a real focus on self. What do I add to this? I think also individual therapy matters a lot, even beyond. So both for addicts and for partners, there's a huge piece of individual therapy early on that needs only to focus on getting stable. Are you working a program? Do you know what your program is? Can you get sober? Can you stay sober? Um, a lot of individual therapy needs to focus on that early. A lot of people punch out of individual therapy once they've been sober or once they've felt okay or have known what to do with triggers for a while. To me, that indicates that the orientation from the beginning missed the whole point. I was looking for the pathology to leave. I wasn't looking to grow up. I wasn't looking to develop. I wasn't looking to better myself as a person. I was looking to get out of Dodge, which makes sense. And again, I hold no judgment for that. But I really think it's leaving some money on the table if all we do is attend to crises. is another thing my wife and I were talking about this morning, and what brought this up is, it's interesting when I see people leave certain systems or organizations or relationships without that internal work. The next organization they get into, or the next system they get into, or the next relationship they get into, at least their involvement in it starts to feel very, very similar to what the old one did. It's just a new set of beliefs. It's just a new set of problems. Because at the end of the day, it's really the growing and the maturing in us that yields a better and better life. Anything else is entitlement. I'll put it this way: anything else leaves the work and the momentum of you getting a better life and a happier life up to the universe. Which, I mean, you're just too much of an insignificant piece of it for the universe to bend to your good without your participation. I have seen when people start participating in that, saying, I really want to change in here, and that's what's most important. I know I've got to unplug from all this stuff out here that I'm trying to manage. I do see the universe show up in that way, which is interesting. But it's not something that comes out of us because we want it. It's something that comes out of us because we work for it. So that is the case I have for what focusing on yourself in recovery means and why it's really important.
I love this, and I say this, I don't even know how many times a week to partners. It's like if you're waiting for your happiness till that person who is just at the very beginning may or may not ever get it to have any kind of happiness or joy or whatever, like it's that whole disempowerment. So when you first started off, and I've got some other things, but we've got a lot of questions. So when you said manage or cut off, and I was like, oh, like and immediately I thought of different people, different relationships, and I want to do that with that one, and I want to do that with that one. So very time I want to ask you a quick question. The the tapestries that you have, are you surprised when your kids or spouse come up and point at certain things? Like, are they able to identify something that you would have not had any idea about?
Yeah, it was interesting on the first night that, we pulled these out of the Amazon box and we're looking at it and we asked my daughter, which one are you? And she points to sad, which was not what I would have picked up. And, she was being goofy, she was being silly. I don't think that sadness was her huge underlying emotion and she was masking it. But I said, oh, why did you point to sad? And she said, I won't have a birthday for a really long time. And I think
Oh,
about every day. Like, um, there's always this. I had a therapist that taught me in my early 20s. He said you're basically feeling every emotion at all times. The one that manifests is the one that you're focusing on. And so he really taught me to kind of like widen my view a bit and just attend, or be able to attend to most of what's going on inside me. Because again, look like that sadness example I'm talking about here. um, we can take something like that, and I have in my life, and we can make it episodic. I'm just having a rough day. I'm just having a down day. Well, I've been having a down day for 18 months. There's something there to look at. So it's always a surprise. This happens in my own journaling too, when I just kind of open the door to all of my parts. What's everybody thinking? There's always something there that's like, I wouldn't have picked that up on the surface read, and I'm so glad that I know.
yeah, that's good. And in recovery, we are taught that we can start our day over at any moment. So even if I had a rough morning, well, here I am right now. And what am I going to choose, as I go forward? So I love it. One more thing. I'm doing a series, a I'm a learning series on control as an illusion. So this is so interesting that you happen to pop this whole topic in right in the middle of that. So, but we've got questions. Okay, so true. I lost myself in getting a PhD in my husband and his dysfunction. I am radically focusing on me. Have an essay as a husband and an alcoholic as a son. Lost me. Any tips on staying focused in me?
So this tip might be a little bit of a downer, but I think it really hacks on what makes us focus on what's important, and that would be counting your losses. thank goodness you started to come to yourself. A lot of people um, don't see how they've lost themselves and feel how badly it hurts until later in life or far down the road in a relationship when they may, I mean, be just too tired to do something about it. So not being afraid to count the previous losses that accumulated because you got your PhD and your husband and his dysfunction. At the end of the day, don't be afraid to count the losses in the ways that you may have neglected yourself in some way. So self neglect and losing yourself is one of those things that once it's there, I think it stays. I don't think it goes completely
Mm.
away. And so the idea isn't to erase that from you; it's to become. I mean, from an IFS perspective, it's to integrate it. I'm vigilant. Can I look for that part of me that loses touch, and that's going to manifest in things that hurt and don't feel good. So count the losses. I would say is a good way to help stay focused on you. I would also make sure that you have strongly competing passions. I mean, you're talking about a son, you're talking about a husband here. Those are really big, impactful relationships. I hope you have some hobbies and some parts of yourselves that are just as compelling and feel just as urgent to get to things that you love. That let's say, for example, your alcoholic son is in his fifth crisis of the month and is calling you, and you're saying, but I had that bike ride with friends planned, and as much as you need this, that sounds really, really good to me. So develop some parts of yourself that can compete and can be compelling. Because again, that pull that we have of love and devotion to other people may not go away, but to have it contextualized in our life around other things that are urgent, important, meaningful to us. That idea of competing passions can help us make better choices for ourselves.
To tie in what you're talking about with the poverty and illiteracy, you know, like with those are massive, and you could go 100 different ways. And so picking one, and it started to transform things, and it wasn't overnight, you know, because it isn't like read to your kid once and then poof, everything's different. But like those patterns and setting the intention, you know, and that would be in a positive direction. So perhaps there's like pick one thing. I love the competing, something that's really meaningful to you to focus on for you. Okay, next question. Thank you so much, John, for your questions at the beginning of the session. It really helps me knowing I'm on the right path. I now understand who my parents are. I also understand how I created my addictive behaviors. I understand how PTSD works in my mind through reading and looking at my own past actions. I recognize how the behaviors and how my compulsions are triggered and how to act on them in a healthy way. Everything makes so much sense, and it motivates me every single day to give myself tons of love and compassion. Yes, yay! Thank you for sharing that.
Yeah, this is a great example of what that external knowledge can do. Our brains play so many tricks on us. The way that our brains deal with reality and perception plays so many tricks on us. So I'm reading here. I learned the patterns of my addictive behaviors. I learned the patterns of my parents. I learned the patterns of my own PTSD. You can start to recognize this. I mean, I was saying it this morning. It was one of those mornings that, like, uh, you get 20 things that come up in a day that all need just 1 minute of your time, but it's never convenient. And, my gripe is often I shouldn't have to deal with this anyway. I know how I get when I'm stressed. So after like wanting to vomit this emotion, I could say, I need to turn this off before I get everybody else infected. I know how that part of me interacts. I know the patterns. I love what this person wrote in. There's a good use of that. I know the patterns, and I cannot have to believe my own mind and body every time. I can wait for something that I know will be better.
Next one is what type of treatment would you suggest for someone who does not struggle with addiction, but rather entitlement and distorted thinking from poorly modeled behaviors growing up? Currently seeing a CSAT and going to SA 4 times a week, but struggle to relate to the part about being unable to stop the addiction. Have not had that problem, but I was extremely entitled. Not that I couldn't stop, but I didn't want to until I got caught and almost lost everything. I grew up witnessing poor behaviors, witnessing a lot of disrespect towards women, and now realize a lot of toxic masculinity.
these are great additions. I'd love to hear it
Yeah.
from your perspective. So I would put it this way. What you're describing may be more on the spectrum of I have a way that my personality is arranged. I have a way that I've learned to get through the world that unless I'm confronted with these big external consequences, I mean, I really believe it doesn't hurt anybody else. And so I'm not diagnosing here, but I would say that sounds a lot like narcissism. And so the kind of therapy, the kind of help that supports narcissism is insight oriented work. You need to work with a therapist who will be able to not just give you tools and exercises to support your ongoing abstinence from problematic sexual behavior, but will reflect back to you what it feels like to be in a relationship with you. Who will not be afraid to call out and dig some of those distorted ways of thinking that will get into some family origin work for you so you can have that integrative experience. I would not drop if there's been sexual acting out, I would not drop support for that. But you may add to or focus on kind of that interpersonal aspect, real insight oriented. I need to develop an internal voice in me that's not just my entitlement. It's not just what I was given. And that's done through, I would say, good old fashioned psychotherapy. You get in a room with your therapist who says something confrontational to you and then asks you, how did it feel to hear that from me? Because that's how a relationship is built, and it's in the context of that relationship that these parts of you can really be addressed. But don't. This would be part of the narcissism too. That's not my problem. Find yourself in that. Your life has been ruined by it. Thank goodness it hasn't been a struggle to stop, but your life has been ruined by it. So stay grounded in that. But your instinct that something might be missing for you is probably right. But keyword missing. Add to, not replace.
Thank you for sharing that. And I was thinking the same thing. Anybody who goes to the meetings and is looking for how I'm not the same, you're missing the point. The first step is the only one that is really about the addictive behavior. The rest of it is about learning to live life on life's terms. So, my least favorite 12-step meetings are those, and I've learned, but are those on relapse. For lots of amazing blessings, have not chosen to relapse. And so, and at first I was like, oh, this doesn't really. And then I went, oh my gosh, how grateful am I that this is not my struggle. And you know what? The other struggles are, I had enough to know I didn't have to keep going out and doing that. But one of my 12-step meetings, with the introductory stuff, we talk about learning to live life on life's terms. It isn't, it's the ism, it isn't the whatever. And so, if you haven't done steps 4 through 9 yet, I bet lots of interesting things could come up for you in those, that would be useful for your work with a qualified professional. So, I agree. Keep going back. There's so much. In fact, Kristen Snowden and Scott Brassert wrote Life Anonymous, and it's
Mm.
the 12 steps because it's just good living. Kristen's not an addict, but she was like, I had control issues and whatever, she shared it on webinars. I'm not telling tales. So she and Scott wrote a book, Life Anonymous, because the 12 steps are just helpful when you're struggling with how to learn to live on life's terms. So I think there's good stuff there for you. Okay, I've been with my partner for 3 years. On New Year's Day, I found out he had been looking at cam models and he had seen a prostitute. We are in couples and individual counseling. He's working on radical honesty, but he's a pathological liar. His parents seem to surface, his parents seem surface level and don't talk about emotions with him unless they are positive. Any suggestions to help with communications when he avoids uncomfortable emotions?
Bring close. Bring close. Pause this. Oh, you're here live, but when you're watching again, pause this. Go get him. I'm going to speak directly to him. Um, all of the emotions, positive, negative, everything in between, those are part of being in a relationship. And if you don't want to or can't do some of it, you don't get the benefits of a relationship. We're talking maturity here. We're talking reality. It's the bending of the reality that gets you in trouble in the first place. And I would be really, really worried if you're doing all this work to confront this problematic behavior and you're not getting at the part of you that doesn't want to confront reality. So it's not pleasant. It's really not pleasant. I on backpacking trips, this is always what I think about. What we have to do is going to suck. There's no way around it. My body's even going to hurt after and during. Um, but I don't get to see the places that I get to see when I'm on foot if I'm not willing to go on foot. And that is really worth it. I'm not able to have the experiences that I'm able to have it with other people who are on foot if I'm not willing to do it. So in short, with all the love that I have, I would encourage you to grow up and stop running from feelings. They're just feelings. And with the right kind of support, the right kind of help, a good therapist who can help hold you through that, these things that scared you and overwhelmed you as a child, which is legitimate, and not just automatically growing out of that is legitimate too. But you can grow into that, you can grow out of that, and you can have a shot at a life that's way more fulfilling than the one you've got right now. I think that's what your partner wants too. That's what I would say to that.
Yeah, and I was thinking Dr. Enid Gray's book, Neglect, one of the examples of neglect is when you have to look perfect. If you grew up in an environment where we always have to look perfect, and if we can only have positive emotions, then there's that facade of like we can only experience good things, which is not real life. Okay. My essay partner finally has a CSAT appointment next week. D-Day was about 6 weeks ago. He's currently in a SA men's group, which is only one work he's doing right now. My frustration is that he is overwhelmed by too much information and wants the guidance of his CSAT, especially since he's struggling with 30 days sobriety. I have worked on boundaries with him, but I feel that I have to limit my discussion so that I don't overwhelm him. I just wish he was immersing himself in learning about SA like I have. I guess I'm just frustrated that I have no control over his recovery and feel frustrated. Is this normal? I'm smiling. So
Yeah.
yes. Yeah.
Oh, it
Eh,
it totally is normal. And um I think it's a tricky needle to thread. And I see in aspects of relational recovery, partners take turns with this position. Um, don't give up on the overall idea here. Hey, there's a lot that you've got to be competent in, man, and you've got to get it faster rather than slower. It's one of those paradoxes of recovery. And at the same time, if you try to go at a pace that is not yours or a pace that ultimately does not work for you, um, any effort you put into this, even tons of work, you could read every book ever written on the subject. If your nervous system isn't there and able to be there, it's not going to do you any good. So it's that paradox. Don't give up on the overall idea for the relationship. Have some strategies that help you. What's the word they use? Detach with love. When the level of where the level of his capacity is frustrating you, or even hanging you out to dry. Have some ways to detach with love, so that you can care for yourself. You can look at what is it like for me to live in a relationship with someone who is so early in their journey and I need them much further. If you're not ready to go, that's what you're going to have to do. Is that detachment, take good care of yourself, and keep putting out there, hey, this is important. I know you've got to. Um, I know you've got to wrap your head around this. I know this is hard, but I need you to keep working your fingers to the bone every day on this. That's often where I see a lot of goodwill from partners who have been betrayed evaporate, is when the person who has done the betraying is insistent that their recovery will be their own way. And it's not with humility. It's not, hey, I'm recognizing I have real limitations and I've got to work on that. Please, please, please be patient with me. It's more like, why are you always so demanding? Um, so I think that's the paradox you've got to be in there. And yeah, this is where that first step prayer comes in. The serenity prayer, not first step prayer, the serenity prayer comes in. Um, see what you can and can't control, work on a lot of surrender, and work hard with what you can.
Yeah, and for him, 12-step meetings are free, 90 meetings in 90 days. Scott and I did a webinar, my colleague Scott and I did a webinar on 2/7/24, and I put the link in, on navigating the 12 steps. So, one 12-step meeting a week, which I'm not saying he's doing, but I'm kind of reading that. I'm not 100% sure. But to combat something that's 24/7, you know, it's a safe place, at least for an hour. Like I know where my brain is. I'm focusing on these things. So that would perhaps help him with the overwhelm. And I posted the link. This video will be posted later. You can suggest he watches, but for you, like this is absolutely, the dysregulation, I understand. I completely get it. You getting a PhD in him and his addiction and him going like, I'm in preschool, there's a disparity. So, but you focusing on what do I need to do to take care of myself? The Healthy Boundaries work group is starting yet this month. The betrayed partner one started yesterday and you could still join that. So those no, work groups, sorry, too many words. Work groups are on that link I just shared too. Okay, the next one. I know that by refocusing on less intense sexual pathways from porn, it opens the door to emotional intimacy and connection with my partner, something that is lost completely with an escalated arousal template. I've heard the intensity of emotional intimacy with a loving partner is significantly more rewarding than any high I could ever get from the more troubling elements of my arousal template. How do I restore more faith that this will be the experience that I have to, if I stay on the path I'm on?
Um, I wish I had. I was in Michigan this weekend doing a level 2 enmeshment workshop with Dr. Adams. We had 14 guys, and I wrote down a quote this guy said because he was talking about his caretaking and his firefighting and planning perfect dates, and he said all of that is actually ultimately avoided at helping me avoid intimacy.
Mhm.
So I think first, restoring your faith that this is the experience you're on, you have to know those intense pathways were an avoidance of intimacy. They were an avoidance of real heart to heart connection with another person. And there can be a lot of reasons for that. I mean, we can have fear of what we find in another person. We have fear of what they find in us. We can have fear of, whether we're adequate. We may not have a really well defined self, and that's scary to put yourself out there where people are looking for that. So I think it starts with really accepting there is no function for intimacy and connection. And what you said, the elevated arousal templates, the escalated arousal template.
Escalated, uh-huh. Yeah.
Yeah, yeah. That's almost a surefire path out of any kind of intimacy. So first that, and then I like what Dr. Rob says about it is get used to life that feels like it's a notch or two above boredom in the beginning, because the comparison, it takes time for your brain to heal and kind of come down into that range. But like we've talked about here, don't just externalize the problem and say I've got to let my arousal template cool off. All those things that I just listed that are barriers to intimacy, you work on simultaneously. Develop yourself, know what your interests are, dive into what your values and your principles are. Know what it is that you're going to be showing another person when they look deep into your eyes. Work on your past. Know what those memories are that make you who you are. Some of them may come with a lot of shame or fear or sadness. Um, they're all part of you. So while you're de-escalating, build that internal resilience, build that reservoir of experiences and emotions and desires where your connection comes from.
And Dr. Rob also says addicts seek intensity rather than intimacy. So if you understand that's where we go and it keeps us away from any real connections, it just being curious and going like, I want to explore this and see, that may help you be on the path too. There's not going to be this magic switch that flips and you're going to go woohoo, but you go, wow, like I'm showing up, I'm more present, I have a good relationship, all of those things. You go, I couldn't have done that when I was, doing all the high intensity things. I have ADHD, betrayed partner. Is there any tips for me to shift my focus from situation, his recovery to myself? I feel this could benefit us both, but it's hard to practice. It absolutely is.
Yeah, ADHD, I think, presents some particular things that are great for you to dive in and to learn about. So if you haven't looked at rejection sensitivity dysphoria, that's something that we see a lot of ADHD folks struggle with, and it's essentially like I'm more sensitive to rejection. It's more devastating to me. So betrayed partner, rejection, that can be one way you can fold into that. Is get to know your own internal landscape, working on aspects of things like that. I think with ADHD too, there's a real need for more integration and friendliness with your body and your own physiological experience. So, again, get to know your own internal landscape, independent from what's going on from the betrayal trauma. I'm not saying like you can turn that off, but look through that ADHD lens as well. Because this may be one of those, like, like my son's airway, the way we're conceptualizing this has a lot to do with what tools we bring to bear on it. So if this is self-diagnosed ADHD, I would encourage you to get a good assessment from someone who's qualified. Work with a therapist or a coach who does the ADHD thing as well, because there are some particularities of that will impact and interact with what your road to recovery is. So you have so much already right there. The way these two things come together for me are going to really create kind of a unique set of needs and opportunities that I want to be really aware of. But that's what I would say about that.
Yeah, and I have mild ADHD and I have to be extremely intentional. And I find going for a walk with intention helps me get grounded a bit. But it's absolutely find some things that work for you so that you can shift your focus to, I love the five things I see, four things I'm like all of those things just help me go, okay, here's where I am. I can get back in my thinking part of my brain rather than, the crazy looping stuff. So. Okay, this is a two-parter. This is tough. May find narcissism such an or many find narcissism such an inflammatory word. My sex addicted husband certainly does. He is diagnosed by 7 professionals and people in his former office. People called it to me. Some family members have pointed this out. He won't listen. It has affected him professionally, and that is why I've tried to reach him by pointing out traits like attention seeking and external validation. And he pointed out that from SA meeting. Anger and putting others down is big. He's lost 5 jobs, has started a new job many hours away this week. He says he has learned his lesson, but only at step 1 in essay. We are almost at rock bottom financially. He's the sole breadwinner and we're not young. I'm scared. That's the most telling thing.
Pick up some books by Romani Dur. You remember how to say her last name, Tammy?
I I will slaughter it with a thick
Durbasula.
Midwest accent. So say it again.
Romani Durbasula. Um, she wrote this book. I've got 3 others of hers. I saw her speak at ITAP. Um, I think I don't want to speak out of my field of expertise, so I'd say pick up her books and start looking at the options you have for yourself. Um, Narcissism will not yield to insight or pointing out. That's that's the structure of the personality.
I just put the name of her book and it's in the chat, so check that out. Okay. The next one is, do you recommend antidepressants if your nervous system is slow or anti-anxiety meds if your nervous system is on overdrive?
Pharmacology is outside of my scope. I'm sorry, I can't answer questions about recommending medication because I shouldn't and I don't, because I'm not trained in assessing or prescribing.
And we are always saying work with a qualified professional if you're the addict partner that understands addiction, if you're the betrayed partner that understands those things that you're going through too, because especially with addiction, it's like people will go to their general practitioner and they'll give them medications, but it's out of context. It's kind of like you're talking about with your kiddo with the airway. It's like, oh, it's a bad cold and we're going to do this, but there's actually more going on. So having the lens of what's really going on and making sure, like, okay, you have addiction, you're working on recovery, and you also have this. Okay, so get the right people. ASAM, American Society of Addiction Medicine, they are like, they have a website. You can find a qualified professional, around you. And if you literally are legitimately clinically, in need of that, yeah, medication. The other thing is there's a zillion things you can try too, in conjunction with that, the grounding, the breathing, all of those things can help you regulate. It's something to try. So you did it. We have time for one more, or do you have, oh wait, I had, oh, I gotta see. Um, I had things when you were talking about, you can ask a question, but I've got this too. When you were talking about continuing to over focus on the pathology is not helpful and it's self-harming, and you're overlooking your path to healing. And I was like, I highlighted that one because I was like, that is so true. And even within some of these that we're talking about, it's like, you hear understandable, we zero blame shifting, but like if you are focusing on someone who's lost 5 jobs, because of all of this, it's what do you need? And again, that healthy boundaries work group could be helpful. How do I create safety for myself so that I can change my focus?
Yeah, I think you have to, again, it's part of that episodic versus big pattern. Systems where there's addiction and individuals where there's rampant addiction, we'll just use that for an example, are not known for thriving through life. So the image I have coming up, it's like trying to diagnose why the Titanic is sinking while it's going down. And missing the lifeboats or the doors where there's room for 2 people or whatever whatever you're looking at there. First, get to a stable, safe place where your future is not all but guaranteed to be dismal. Get to that stable, safe place, and then if you need closure, you're looking at what happened and what was that about. Get there first. But I tell this to the couples I work with all the time: you cannot create security from a place of insecurity. So that's where that early work really focuses you on the choices you have to make, how you come to your own assistance, um, how to get sober, how to stay sober. That's why, because in the beginning, it doesn't matter why it's sinking. It just matters that it's sinking, and you either get to save yourself or you get to go down with the ship, the pattern, the stuff that comes easy but isn't helpful.
And we're going, there's lifeline, save yourself. And we're out of time. Thank you. Thanks, everyone.